Welcome to the Metaverse. And today we are going to discuss a very important topic, that is your blood pressure and its regulation. Okay? It's a part of your physiology syllabus, and we are going to discuss the topic in great detail and what are the factors that are going to affect the blood pressure, as well as what is the definition, what are the formulas of systolic, that pulse pressure, or your mean arterial pressure, that one, and we'll discuss various processes by which blood pressure is regulated, like it may be regulated by your ANS or your vasomotor center, VMC. Okay. Or maybe there are higher centers of regulation. There are some 4 5 mechanisms which tell about the short term regulation of BP. Okay, so we have short term mechanisms as well. uh, People find this topic a bit difficult or complicated, but it is not. It is a very easy topic, and if you read it very conceptually, then we can deal this topic very easily in a good duration of time. So I will be taking up the essence of your guidance textbook of physiology, as well as some inputs from different other books like your boron and so let's discuss the topic, blood pressure and the regulation of blood pressure. Starting with the topic, you must have a basic idea about blood pressure. Blood pressure is the lateral force that is exerted by the flowing column of blood. Like if this is a blood column that is flowing, then the lateral force that is exerted by the blood column on its walls, it is called as your blood pressure. Okay. So if this is your blood vessel, then the lateral force that the flowing column of blood exerts upon the walls is called as a blood pressure. And this flowing column, just pay attention to the words. It is a flowing or moving column of blood. Moving, flowing. Okay, this is your blood pressure. And about values, your systolic blood pressure is 120. Your diastolic blood pressure is 80. If you are telling these values, then it's well and good, but we have a range, so you can just put plus minus 15 in it, and this is plus minus 10. This is the range, and the units are the millimeter of mercury. This is also millimeter of mercury. So we have the systolic blood pressure and the diastolic blood pressure. We have a another term. We have another term, that is your mean arterial blood pressure, that is MAP, mean arterial pressure. This mean arterial pressure, we have a formula. In fact, we have two formulas. Like one formula is the just a manipulated or your devised version of another formula. So we have mean MAP is DBP. What is DBP? Your diastolic blood pressure. Okay, and 1/3 of systolic blood pressure minus your diastolic blood pressure. This is the formula for your MAP. Okay, mean arterial pressure. And if you just solve this, just let me solve it and show you. DBP plus 1/3 is basic maths, nothing else. DBP is equal to 1/3 of SBP. 1 minus 1 by 3 is 2 by 3 plus 2 by 3 of DBP. This is another formula, okay, of MAP. Don't get confused if it is given in the form of DBP. Let's say you have your MAP and SBP given, they may ask you DBP in objective type of questions. So don't get confused in it. Okay, and then we have something called as a pulse pressure. Pulse pressure, and the pulse pressure, simple formula, your systolic minus diastolic. Systolic blood pressure minus diastolic blood pressure is your pulse pressure. And this pulse pressure specifically indicates the stroke volume. Okay, the pulse pressure is a basic indicator for stroke volume. The values you can just write about 40 mmHg. Here we have ranges also. Some say it's 42 to 45 or 40 to 45. We have many ranges, like books differ in it. And MAP, you can simply write it's get very complicated to like remember the values. So you can just write 100 mmHg, around 100, around 100, 97, some say. You can just remember 100. Let's, but this basic discussion is there. Then we have the BP regulation. Let's move straight away to the mechanisms of BP regulation. And to remember, you can just remember a mnemonic, Ava Hills, just a name. Okay, Ava Hills. So, what are the types of regulation? These are the types of regulation, or like the name of the mechanisms. You can just use this mnemonic. It's a mnemonic made by me only to remember. And A stands for ANS regulation. You must have heard about the different systems of ANS, like sympathetic and parasympathetic, or thoracolumbar or your craniosacral outflow, and how they regulate the BP. We'll discuss about that in some detail, not great detail. Like ANS is independent chapter, so we'll not go into detail. Then another center is there that is called as a vasomotor center, or VMC. We have the BP regulation by VMC as well. Okay, we have the regulation by VMC. You can take VA as vasomotor center, vasomotor center. H is for higher centers. H is for higher centers of blood pressure regulation. Okay. Then I. I is simply I is nothing but you can just remember HI. Yeah. L is a long term regulation. S is the short term regulation. You can just write another one, VA, vasomotor, as well as vascular mechanisms. Vascular mechanisms. So we have these mechanisms. One is the ANS regulation, vasomotor center, vascular mechanisms, higher centers, long-term regulation, and your short-term regulation of blood pressure. Understood? Done. Let's first come to your ANS regulation. Okay. Let's discuss how the ANS regulates the BP. So ANS, just simply I'm giving the basics, not much in detail, not the innervation. You know about the nodal pathway, about the conductive system of heart and other things. Just I'm giving like what are the things which are there. Like we have the parasympathetic nervous system and the sympathetic nervous system. You know this all. Okay. Um, what will sympathetic do? It will increase your heart rate. It will increase your heart rate. Okay. What is the property called? If the heart rate is increased, that is your chronotropism. Chronotropism. So positive chronotropism. Positive chronotropism. Here we have the negative chronotropism. Okay, negative chronotropism. Then what it will do? It will increase. It will increase the force of contraction. It will increase the force of contraction of heart. So increase force. What is it called? It's called ionotropism. It's a positive ionotropic and it is negative ionotropic. Understood? And it will increase the conduction velocity of impulse. Okay, just increase velocity. I think velo. What it is called? It is called as a dromotropism. So it is positive dromotropic, and this one is the negative dromotropic. Understood? And one more. What is this? Excitability. Yes. So increase excitability, which is called as a bathmotropism. So it is positively bathmotropic, and this will decrease the excitability, that is negatively bathmotropic. I guess you know this from your basics of that chapter, the nerve muscle physiology. You all know this, okay? And these are the effects of ANS on your blood heart. Okay, these are the effects on heart. Let's discuss what are the effects on the blood vessels. What are the effects on your blood vessels? So just remember, there is no parasympathetic innervation on blood vessels, so it will have no effect on blood vessels. No effect at all. Remember this forever. We have no parasympathetic innervation on the blood vessels, so it will have no effect on blood vessels. So on blood vessels, what are the neurotransmitters of sympathetic nervous system? Noradrenaline, adrenaline, you know this? Yes. Yes. So we have adrenaline and let's write noradrenaline. What will it do? It will do the what are the effects of noradrenaline on your blood vessels? It will do the vasoconstriction. It will do vasoconstriction. It will do vasoconstriction. Understood? And what will happen if vasoconstriction occurs? What will be the effect on your resistance, on your peripheral resistance? If vasoconstriction occurs, there will be increased peripheral resistance as well. Increased peripheral resistance, and increased peripheral resistance as well as what it will do. It, if the peripheral resistance is increased, if the resistance to flowing blood is increased, what it will do to the venous return? Yes, it will increase the venous return. Will increase the venous return. Understood? So you know about the now you know how the ANS is basically controlling the blood pressure. You know about this. Understood? Let's move on to another one. Let's take what was the second one? Yeah, vasomotor center. Let's discuss about the vasomotor center. This is new to you. Probably you haven't heard about vasomotor center. What is the location? If you have a basic idea of neurophysiology, you can just about the reticular surface, or if you don't know, even there is something called as the reticular surface, okay, which is there in the medulla and the pons as well. So it is located in the reticular surface of medulla. You know about the medulla, brainstem and all. Medulla, and one third of that is basically the lower one third. You can just write lower one third of pons. It is located there. Okay, and this vasomotor center is basically a group of areas. Okay, we have some areas like C1 area, A1 area, A2 area. We have some groups like that. So it is basically a collection of areas which are there in the reticular surface of this medulla and pons. Okay. So we have something called as a let's discuss about A1. Okay, what is A1? A1 is called as a vasodilator area. What it will do? It will do vasodilation, of course. A2. A2 is called as a sensory area. Sensory area. Understood? And we have something called as a cardio inhibitory area. Sensory area as well as cardio inhibitory area, and these two areas are located in NTS. Do you know what is NTS? The nucleus subtractus solitarius, and this nucleus subtractus solitarius is also present in this areas which I am discussing. I will not go into the cranial columns now because it will complicate the matter, which we don't want. Okay, I will just tell what the let's discuss the areas in some detail, and then we'll just basically look what is the PMC is doing. That much is enough at your level, and how it is basically doing. What are the culminating effects of areas? What are the pathways? I'm not going into it because it's beyond the scope. Vasoconstriction, vasodilator. Yes, we have something called the vasoconstriction area also. It is called as C1. A1, A2, cardio inhibitory, and the C1. Basically, I'm discussing four areas. Okay, this is a vasoconstrictor area. You know about the function now. So it is located. This is a vasoconstrictor area. Where it should be located? It should be located in the half, upper half of medulla. Okay, located in the upper half of medulla, and this vasodilator area is present in the lower half of medulla. The lower half of medulla. It is this one is in the upper half of medulla, and this one is in the lower half of medulla oblongata, and this one is in NTS. Yes. So basically, what is happening? These areas are not much important at your level, but let me state the function of BMC. How it is basically controlling your blood pressure. Just you have to remember this. Just this box you have to remember. Vasomotor center, your BMC. If BMC is stimulated, And if VMC is inhibited, what will happen? If the VMC is stimulated, what it will do? It has more, if it is stimulated, it will demonstrate a vasoconstrictive effect. Vasoconstriction. Vasoconstriction. And if it is inhibited, or if it is downgraded, okay, downgraded, it will show a vasodilatory effect. So vasodilation. And if it gets stimulated, there will be cardiac stimulation. The cardiac stimulation, and this will cause cardiac inhibition. Okay. If vasoconstriction, cardiac stimulation will be there, the BP will be increased. And if there is cardio inhibition as well as vasodilation, the BP will decrease. So stimulation of VMC will increase your BP. Just have to remember this. Understood? Okay. So let's come to some higher centers. We discussed about some higher centers as well. Let's come to higher centers first because it is related with VMC. Let's discuss what are the higher centers of regulation. Higher centers. So the reticular substance and the thalamus, hypothalamus, even the motor cortex, these have a effect on the VMC. It may stimulate your VMC or it may uh, inhibit your VMC. Okay. So there is the lateral. We have four portions. I'm not going to architecture of the reticular substance. Let's say this is a reticular substance. For example, this is a reticular substance. RS. Let me write. I divide it into this part, and let's say this is your mm, medial side. This is your lateral side. This is your superior side. This is your inferior side. This is the orientation. You don't really need to remember how it is present in the brain or so. So if the superior and medial part, and this is a superior part and medial part, this is a lateral part and inferior part, lateral inferior and superior medial part, and this is a lateral and superior part, and this is your uh, what it will do, like medial and inferior part. So we have two parts which are concerning this lateral superior part. This lateral and superior portion of the reticular substance, this will stimulate your vasomotor center. This will stimulate your vasomotor center, that will increase the BP. Understood? It will increase the BP. And this medial inferior portion of reticular substance, this will inhibit your vasomotor center, which will decrease the BP. It will decrease the BP. Could you understood this? Could you understand this? And we have the hypothalamus as well. Hypothalamus. Just remember this, the posterolateral portion of hypothalamus, this will stimulate the VMC. Will stimulate the VMC. This is another center which will impact. This is another higher center which will impact it. Second higher center is this lateral superior. Third higher center is this medial inferior. Fourth higher center is the motor cortex, and this motor cortex will stimulate your VMC. So these are all your higher centers that will affect your blood pressure. Higher centers affecting your blood pressure. Okay. So you understood all of this, like your ANS regulation is done, BMC is done, vascular mechanisms will discuss, higher centers is done. We have long term as well as short term regulation. It's conventional. Let's discuss the short term regulation of blood pressure first. Short term. If you can understand the importance of this topic which I'm teaching, the first thing is it's important because blood pressure, the hypertension is very common now. Hypertension is called as the silent pandemic. is silently impacting many of them because it's a lifestyle disorder. Basically, lifestyle modifications can erase this hypertension and all. So it is a silent pandemic and is impacting many. And in diabetes mellitus, which you know is very common, blood pressure and this associated concepts are very important. If I talk about importance in exams in NEET, PG as well as USMLE, questions are asked from the blood pressure chapter. This mechanism type of things, like if I just think of physiology, I think of some core concepts which are there in physiology. Like one is the micturition, okay, of renal topic. If I talk about CVS, the CVS is all total important. Blood pressure has been asked many times in the prof exam as well, and it's a core concept which you need to know in any case, okay, in detail. So I'm discussing it in detail. This much detailing is enough for any level. You can deal all such questions in your level, whichever you are going to just plug in charger. Let me, yes. Okay, so that's about the importance of this topic. Please read this topic very carefully because it will fetch you straight away many marks which are important. And if I talk about your profs, many questions are asked. I have seen the prop papers, and every year or every alternate year it is repeated. It comes in any format. It may be a long question, the regulation of BP. Short-term regulation is itself is a long question. Long-term regulation, if you read it with your renal physiology associatedly, then it is a long question, RAS mechanism and all. Short-term regulation, yeah, very important. And short notes, every short-term regulation mechanism is a short note. Your baroreceptor reflex, short note. Chemoreceptor reflex, short note. CNS systemic response, viva, short note, anything. Atrial reflex, it may be asked during a viva and all. Okay. Uh, Many things. Okay. Short-term regulation. So we have here five mechanisms. Let me make a mnemonic: BCCA. BCCA. Okay, it's basically BCCA square. Just you can remember. No need to make mnemonic even, but if you want. So first one is the baroreceptor reflex, chemoreceptor reflex, baroreceptor reflex, chemoreceptor reflex, CNS ischemic response, and this one A for atrial reflex. Okay, atrial reflex, and another A is your abdominal compression reflex. These are the mechanisms which are there in a short-term regulation of blood pressure. Baroreceptor, chemoreceptor reflex, CNS systemic reflex, atrial reflex, and abdominal compression reflex. Okay, and you can remember very easily BCCA for your detail. Let's discuss first about baroreceptors. Baroreceptor reflex. So what do you mean by baroreceptor reflex? We'll go in that sequence. The other name is sino aortic reflex. It's also called as a sino-aortic reflex. It's just the other name. Baroreceptors, if you know, we have the internal carotid artery. We have the internal carotid artery. So in the walls of your internal carotid artery, we have your baroreceptors. Baroreceptors are also present in your carotid sinus, not the carotid body, just note carotid sinus, and it's also present in your aortic sinus. Aortic sinus. So that is a location of your baroreceptors where they are present. The blood pressure range of baroreceptor reflex, where the baroreceptor, the range of blood pressure at which baroreceptor works is 60 to 180 mmHg. The 60 to 180 mmHg, and they work best at 100 mmHg. This also asked. This also is asked. Okay. Just I'm giving you a flow chart of how this works. Okay. First thing, it works when there is increased BP, where there is increased BP. Let's say the BP is increased. The BP is increased. Okay. So of course, the baroreceptors are there, so it will be sensed by baroreceptors, and got sensed. This baroreceptors will send signals via two nerves. Two nerves. The first one is the ninth cranial nerve and the 10th cranial nerve. Ninth and the 10th cranial nerve. These nerves here, as per their functions, are also known as buffer nerves because they are moderating the blood pressure. So these are your buffer nerves. And this buffer nerves will take the signal to a center which is called as a NTS, your nerve of tractus solitarius. This NTS in turn will give the secondary signals. This NTS will give secondary signals, and this secondary signals will inhibit the vasomotor center. The secondary signals will inhibit the vasomotor center. This inhibition of vasomotor center in turn will cause two effects. This inhibition of vasomotor center will cause two effects. First one, it will inhibit the vasoconstriction area. That is your C1. It will inhibit the vasoconstriction area. So what will be there of their arteries? There will be arteries will be vasodilation. There will be vasodilation of artery. If there is vasodilation of artery, what will happen? The peripheral resistance will fall. If there is less resistance, blood will flow. If there is flow of blood, the BP will be normal. BP goes to normal. Another thing, it will vasoconstriction area has property of acting both on arteries as well as veins. So it will of veins also, it will cause vasodilation of veins even. So if vasodilated, there will be decreased venous return. Vasodilation of vein, there will be decreased venous return. And if there is decreased venous return, the cardiac output will decrease. If this cardiac output decrease, the BP will be normal now. The BP will start decreasing. Okay. And the second thing, if the BMC is inhibited, this is the first thing which will happen. And the second thing will be that there will be excitation of your vagal center. Another one, vagal center. And vagal center, vagal term means which one? Parasympathetic. And this parasympathetic activation, what it will do? Of course, will decrease the BP, decrease the heart rate, decrease the force, decrease the contractility of heart, decrease the velocity of impulse conduction. Okay. So BP again comes to normal. This is the effect of your baroreceptor reflex. So you understood what it is basically doing. Increased BP sensed by BR, buffer nerves, NTS, secondary signals inhibit the BMC, will inhibit the vasoconstriction area and activate the vagal center. Vasoconstriction area will dilate the arteries and veins, which will bring the BP to normal, and the vagal center will decrease all of this, which will bring the again the blood pressure to normal. So increased BP is brought to normal by this reflex, by this you can say, yeah, reflex and CLs. Understood? Another term is there. Uh, I don't know if it is helpful for your level or not, but there is something called the baroreceptor resetting. You know about resetting the things, like you reset your phone so as to bring it, so as to cause it work well. Okay. So baroreceptor, if there is hypertensive patient, the hypertensive patient, there is a problem. I can say there's a problem due to which the baroreceptor reflex will stop working. Like our body has a property, we have an inherent property to adapt to changes. So if there is a hypertensive patient, there will be increased BP, chronically increased BP. Hypertension is defined what it is actually, chronically increased. So if there is chronically increased BP, then we will get used to the new BP in 2 3 days. Like baroreceptor reflex is just a reflex. It's a reflex. We'll get used to the new BP in 2 or 3 days. That is the new normal. That is the new normal. Gets used in 2 to 3 days. If it gets used to 2 to 3 days, the baroreceptor reflex will think the increased BP is normal, and if it thinks like that, it will stop working. So it will won't work, and if it won't work, this is called the baroreceptor resetting. The baroreceptors are reset. Of course, it is good for hypertension to progress, but it is bad for our body. So therefore, we have another reflex, a less powerful one, I can say, that is a chemoreceptor reflex. Chemoreceptor reflex. So we discussed baroreceptor reflex. Now we have chemoreceptor. It's a bit less powerful than the baroreceptor reflex. And let's discuss the chemoreceptor reflex. Chemoreceptors are basically located in the bodies, that is a carotid body and aortic body. Location is the carotid and aortic bodies, and these are basically H plus sensitive, right, areas. H plus sensitive areas. If I'm giving you a analogy, like not analogy, that's a just a conceptual thing. Let's say BP falls below 80. Let's say mm, this will work when BP falls. So I'm writing in big font. BP falls, and BP falls beyond below 80 mmHg. If the BP falls below 80 mmHg, there will be oxygen lack, of course. Oxygen lack, you can just well imagine and think. If you take time, it's okay if you're taking time to think. Oxygen lack and CO2 excess. If there is increased CO2, what is CO2? It is acidic or basic or neutral? Acidic. And if CO2 is acidic, there will be H plus increase. Why I'm saying acidic? If you dissolve CO2 in water, what will form? H2CO3. H2CO3 breaks down, into H plus and HCO3 minus. If it breaks down, it will increase the level of H plus or not? Yes? Yeah. Increased H plus. This increased H plus will again be sensed by these two nerves, ninth nerve, 10th nerve. In fact, we have special names of these nerves. If you want to know the special name for these branches of nerves which are basically doing this function, this ninth nerve is called the nerve of Herring. Nerve of Herring. And this 10th nerve is basically called as the nerve of Sian. Nerve of Herring and nerve of Sian are the two nerves which are basically carrying the signals of increased blood pressure. Basically, this H plus increase is sensed by the chemoreceptors, and this ninth and 10th nerves are carrying the sensations of this increased blood pressure to another center, not NTS this time, directly to the vasomotor center. So now this is your vasomotor center, which is getting directly stimulated by this ninth nerve and 10th nerve. And from this vasomotor center, there will be some nerves arising, the sympathetic nerves, simply sympathetic nerves. Of course, you can know the function, what it will do sympathetic action. Actually, the short-term mechanisms are well intrinsically related to the ANS mechanisms as well. These are not something very separate in their domain. So sympathetic nerves, and the sympathetic nerves, there is no parasympathetic innervation on blood vessels, but there is sympathetic innervation. So it will stimulate your heart, as well as blood vessels, stimulate your blood vessels. So if heart and blood vessels are stimulated, Uh, of course, there will be increased BP, increased heart rate, increased stroke volume, increased force of contraction, increased velocity of conduction, increased contractility, increased excitability, anything you can write. So blood pressure comes to normal. That is, blood pressure is increased to the normal level. So fall in BP, H plus excess, carried by nerve of Herring, nerve of Sion, stimulate the VMC. Sympathetic nerves stimulate your heart and blood vessels, so bring the BP to normal. Understood? Easy? Yes, it's easy. Very easy. It's okay. Then let's another reflex. Yeah. So baroreceptor is done. Chemoreceptor is done. Let's come to your atrial reflex. Let's come to atrial reflex. Or before discussing, yeah, let's discuss the atrial reflex. Then we'll go to your CNS system. So atrial reflex, one thing, if you don't know, let me tell you. So atria, basically the atria has stretch receptors. Atria has stretch receptors. So if there is increased BP, of course it works in increase in BP, increased BP. If there is increased BP, it will increase the arterial blood pressure as well. Arterial blood pressure increase means arteria, ventricle, all there will be increase in blood pressure. So increased arterial blood pressure, increased arterial pressure will exert, let's say if this is the atria, the blood will exert more force. If the blood exert more force, there will be dilatation of this atria. And if there is dilation, there will be stimulation of the stretch receptors. Understood? The stretch receptors will be stimulated. The stretch receptors have two functions. The stretch receptors have two functions. One function, it will affect the hypothalamus. First thing, it will give the signal to your hypothalamus. And if hypothalamus is stimulated, it will decrease the ADH. Do you know ADH? Antidiuretic hormone. What it will do, we'll see. Another thing, let's discuss second thing, then it will be very easy. Another thing, it will dilate the afferent arterioles of kidney. Dilate, this is very important. Afferent, just understand, arterioles of kidney. Afferent arterioles are dilated. Just imagine your nephron. You know about the nephron? You know the basic structure, right? Know this. The collecting ducts are there, and another things. I don't need to draw all this, of course. Here is the afferent arteriole, which is bringing in blood. Here's the glomerulus, the tough capillaries, and this is the efferent arteriole, which is way more thinner. Let's say if this afferent arteriole is dilated, if it gets dilated, if it is dilated, the artery is dilated, then there will be increased flow of fluid. There will be increased filtration. Okay, so there will be increased glomerular filtration rate. If this GFR is increased, there will be decreased water absorption. GFR is increased, your glomerular filtration is increased. So there will be, if there is more filtration, then decreased absorption, decreased water reabsorption. And if there is decreased water reabsorption, there will be increased output, increased urine output, increased urine output. And if there is increased urine output, urine is, what is urine, that is water. So there will be decreased blood volume, decreased blood volume. And this decreased blood volume will cause decrease in BP as well. Please. So you understood what is happening. This is a concept. So dilate the afferent arterioles of kidney. This will increase your GFR, will increase your urine output, which will decrease your blood volume, which will increase your blood pressure. What will the ADH do? Decrease ADH means increase GFR. Do you understand this? Antidiuretic hormone. That is antidiuretic, preventing urination. And this is decreased. So excess urination. So increase GFR, increase urine, decrease blood volume, increase BP. Done. Easy. This is arterial reflex. We have another thing to discuss. Uh, you can just say it's a variant of this atrial reflex, that is your, let's write it in big words, Bainbridge reflex. Bainbridge reflex. Another this one. We must have heard this term, very famous. So if we give a IV fluid infusion, if we give a IV infusion, you give a saline to some patient, IV fluid infusion. If there is IV fluid infusion, it will increase the blood volume. So it will stimulate the atrial stretch receptors. I am writing ASR, you can understand this. Stretch receptors. It will like stretch receptors. So SA node will be stretched. Okay. So it will stretch the SA node stretched. So there is an alternate pathway. This SA node is innervated by the 10th nerve, that's the vagus nerve. So via, if this SA node is stimulated via the 10th nerve, it will stimulate the medulla, and this medulla via afferent fibers. This medulla has in turn some afferent fibers, due to which it will inhibit afferent fibers, inhibit 10th nerve. Okay. So it is basically a like someone is giving you information and you are spreading rumors about that person only. So he will or she will stop giving you information. So 10th nerve is stimulating the medulla. It is giving money to medulla, but medulla is taking away its money. So it will stop giving you money. Okay. If this 10th nerve is inhibited, just see above. What was 10th nerve doing? It was decreasing the BP, decreasing. It was like stimulating the parasympathetic, like just bringing the BP to a normal. Let's say that. So if this 10th nerve is inhibited, what it will do? There will be this 10th nerve. What nerve is this? Parasympathetic nerve. Just you can remember like this. Parasympathetic nerve. If this parasympathetic nerve is inhibited, it will stimulate the sympathetic nervous system, and this SNS, what it will do? Increase the heart rate, increase contraction, all such things. It will increase the BP. So basically, what is happening? If you want to describe this Bainbridge reflex in one word, I told you the mechanism. If you want to describe, IV infusion will cause increase in blood pressure. So if you have to take care if you are giving an RL or saline or some other thing you are giving. Understood? Let's move on to next one. It's taking more time than I expected, but it's all right. We are studying in a very conceptual manner. Let's talk about CNS, ischemic response, another short-term regulation mechanism. We're spending more time on short-term regulation. Long-term regulation is basically the RAS system, and that's another big topic to discuss. I will give you an like if you have a long question to attempt, so you can write enough contents. I will tell you that. Let's discuss first about CNS ischemic response. Okay. Also, in some books, it is written as a last ditch response. Last ditch response. Last ditch response. Let's say here in above part here. Why it's called last ditch? I'm telling you that. Baroreceptor reflex worked best at 100. So if BP falls beyond 100, so it will have a short term like action, predominant action you can say. Baroreceptor is more common and predominant than more powerful even than the chemoreceptor other ones. Then BP fell again like 100. If you know about the disadvantage of this baroreceptor reflex, baroreceptor resetting is the disadvantage. So let's assume that BP fell even more. Like it comes to 80 and falls beyond 80. If it falls beyond 80, then chemoreceptor will do its job. The chemoreceptor even failed. Then this one comes to action, the last ditch or the last resort to fall in BP. This is a CNS ischemic response. The CNS ischemic response, if the BP falls, it will work beyond 50 mmHg. A very severe fall in BP, there will be CNS ischemic response. Ischemic, you can just know from this term, ischemic. Ischemia. Ischemia, you know? Yeah. So it will cause the ischemia of BMC. Vasomotor center is ischemic now. No enough oxygen is reaching the BMC. There is accumulation of CO2 and lactic acid in the body. Okay. And this ischemia of BMC will itself stimulate your BMC. Very funny, right? Ischemia is stimulating the VMC, and this VMC again tries to increase BP. This will again try. It will give another try. Okay. In many cases, you are seeing VMC is basically doing its job, and VMC again tries another attempt to increase the BP. So you can see how our body is trying its level best to increase the BP. Let's say if marks is your blood pressure, and you must be a VMC. You must be a VMC rather than a baroreceptor or something. Baroreceptor is letting the situation go. It's adapting to low marks. You should not. You should not settle for the least. Okay. So be a vasomotor center or VMC and give another tries as well. Okay. But what we can do if we don't read, like let's say the body is not reading or your blood pressure is falling, even then the BMC is trying to stimulate the BP, but yeah, if it does, well and good. But if it can't, let's say if it can't, there will be BMC failure. The person will not be able to increase the BP, and it's a very severe condition, lead to death. So these are your responses. These are your things which are important. CNS systemic response. We discussed about that. You must have heard another thing which is called the Cushing reflex or Cushing's reaction. Cushing's reaction. So Cushing's reaction, we have something called the Cushing triad. Cushing triad. So Cushing triad, what we have? We have bradycardia. Bradycardia, decrease in your heart rate. Okay, bradycardia below 60. And we have hypertension, bradycardia, hypertension, and Stokes respiration. This is a Cushing triad. If this all happens, we have the Cushing triad. This is not much important at your level, but Cushing reaction is important. Don't I discuss this because don't confuse this with this triad and reaction. Don't confuse. Please don't confuse. Yeah, these are all separate things. So Cushing's reaction is basically a mechanism to protect the vital centers of the brain. Uh, it also works when there is decreased BP. So what is happening in Cushing reaction? I'm telling you, it's basically related with this CNS systemic. So I'm discussing it along with. Let's say there is increase in CSF pressure. Remember the cerebrospinal fluid? If there is increase in CSF pressure, what it will do? Of course, increased pressure means artery constricted or dilated. Constricted. Compression of arteries. Compression of arteries. It will cause the compression of arteries of brain. Okay, very important. Compression of arteries. Increased CSF pressure may be attributed to many conditions, many pathological states. If there is increased CSF pressure due to any cause, it will cause the compression of arteries, which will cause a falling of BP. The BP falls. Then the CNS ischemic response. in the CNS ischemic response, if the BP falls, this will come to act. So I'm writing CNS ischemic response, CIR. This will try to restore the BP, restore. And if it can restore BP, it will protect the vital centers of brain. If it can't restore BP, the vital centers of brain will fail. The person will die at any cost. Okay? So it will restore the BP, this CNS systemic response, and protect. This is a protective reflex. This is basically a protective reflex to protect the vital centers of brain. Understood? So that is about your Cushing reaction. Let's discuss another part, which is your vascular mechanisms. So we have some vascular mechanisms, not much important. Vascular mechanisms to restore your BP. Okay. Uh, we have something called the stress relaxation or let's discuss some basics. Stress relaxation mechanism. First one, stress relaxation mechanism. So if there is increased BP, there will be stretch of smooth muscles. Let's say this is a muscle. This will stretch. There will be increase of smooth muscle. If the muscle is stretching, it will relax also. It will relax also. And if it relaxes, the BP is normal. Very absurd thing, but it happens. Okay. Stress relaxation. Likewise, we have something called the inverse stress relaxation as well. If there is decreased BP, what it will do? It will decrease the stress and stretch. The muscles will contract. If it contracts, what will happen? BP normal. BP again increases. And BP increases means it's brought back to normalcy. Understood? Another thing, we have something called the capillary fluid shift. You know about the capillary forces and all. I'm not going into this detail. We have something called the arterial end and the venous end. Arterial end and the venous end. I'm discussing it in a short span, so it is difficult to like go into much detail what are the capillary forces and all. We don't need in this topic. Just you understand the basics and that's enough. Increase BP, increase BP. Let's say there is increased BP. There is increased pressure on capillary. The pressure gradient is increased. The pressure is increased. Means there is increase in pressure at the arterial end and decreased pressure at the venous end. That means pressure gradient is increased. If there is increase in pressure gradient, there will be increased fluid that will be shifting out like this. Increased fluid shift. And if there is increased fluid shift, there will be blood volume will be decreased because interstitial volume is increasing. It may cause edema. Okay. And but the blood volume, it is decreasing, and blood volume is decreasing means BP will be decreased. Understood? This is a capillary fluid shift. There is something called the inverse capillary fluid shift as well. So four mechanisms. Inverse stress, or you can write this stress relaxation mechanism is also called as a stretch relaxation. Stress, or this you can write stretch. And this capillary fluid shift, and we have something called the inverse capillary fluid shift. Four mechanisms. We have in vascular mechanisms. Inverse capillary fluid shift, another mechanism. Let's say we have the fall in BP. So if the BP is falling, there will be decreased pressure at arterial end of blood vessel, arterial end of capillary in exact capillary. Decreased pressure at arterial end. If there's decreased pressure, there will be increased absorption of fluid, or you can say less fluid is being now coming out of this pores. Increased absorption means blood volume increases. This blood volume increases means BP increases. This is another mechanism. So this we discussed about four mechanisms in the vascular mechanisms. One is the stress or relaxation mechanism, inverse stress relaxation, capillary fluid shift, and inverse capillary fluid shift. So these are your four mechanisms which are there, okay, in your vascular mechanisms. We have something also called as the abdominal compression reflex, which is not much important. still I'm discussing in the short term mechanisms. It is there: abdominal stress, or you can write abdominal compression, not stress. Abdominal compression reflex. So in abdominal compression reflex, let's say due to any cause your VMC is stimulated. Your VMC is stimulated. Okay. By skeletal nerves, this is mediated by skeletal nerves. Just remember this: skeletal nerves, because abdominal muscles are basically uh, innervated by your skeletal nerves. This will stimulate your abdominal muscles specific. Okay, your rectus abdominis, you know about the abdominal muscles. I'm not going. If this gets stimulated in abdominal muscles, we have some venous reservoirs as well. We have some veins and venous reservoirs where blood is stored. Muscle is vascular, right? So it will cause, if the abdominal muscles are contracted, there will be, I'm changing the color, compression of venous reservoirs. Compression of venous reservoirs. If these venous reservoirs are compressed, it will increase the venous return. Venous reservoirs are compressed. Of course, it will increase the venous return. The return will be more, right? And you know about this. If the venous return is more, that means what it means? Your cardiac output will be more. If your cardiac output will be more, your BP will be more. A bit absurd mechanisms: skeletal muscles, abdominal muscles, and this compression of reservoirs and all. But you can just remember this. Okay, no problem. If you don't write this abdominal compression reflex also, it's well and good. It's like all right, not well and good. If you want marks, you have to write. There's some bit wise distribution of marks are there. That is the point. So we are running out of time. I thought it will be a video of 30 minutes or 40 minutes, but it's getting late. Okay, no problem. Long-term regulation. I will be discussing long-term regulation in less detail because you know about all this, and we'll discuss some miscellaneous factors, like some mediators are there like ADH and angiotensin and all. We'll discuss about that. Let's discuss about the long-term regulation now. So in long-term regulation, if you have read the renal physiology, it will be very good. If you haven't, I will try to make it easy for you. Not It will be easy if you have read. Basically, I will say that. So long-term regulation is basically done by the very famous organs, that is a kidney. So kidney has a property of infinite gain principle. Okay, if there is decreased water excretion, or if there is decreased salt excretion, there will be long-term regulation of BP. That is, the long-term regulation of blood pressure is stimulated. Mark my words, by the inhibition of pressure diuresis or inhibition of pressure natriuresis. Inhibition of pressure diuresis. Pressure diuresis, increase excretion of water. So if water is not excreted, that is what it means. Water is not excreted. I will discuss it. You just wait. Or if there is increase, there is pressure natriuresis. That is in inhibition of salt excretion. If there is inhibition of pressure diuresis and inhibition of pressure natriuresis, the stimulation will be the long-term regulation of BP will be there. Okay, it will act now. Basically, I'm talking about the RAS mechanism. Let's say we have excess salt. I'm taking a situation. Excess salt. Let's say we have excess NaCl. We ate excess NaCl. You ate salt. Anything you want. First thing, it will increase the osmolarity. You know about that. It will increase the osmolarity. If it increases the osmolarity, it will increase your thirst. And if this thirst is increased, you drank more water. You drank more water, and drank is not correct English, right? You drink more water. It will increase your extracellular fluid, ECF volume, ECF volume. It increased your ECF volume. That is, it increased your blood pressure. So if there is pressure natriuresis, that is inhibition of salt excretion, that is increased NaCl, then increase in osmolarity, it will increase your BP. The blood pressure will be increased. Just remember this. Understood? This is the whole point of this discussion. Then comes your RAS mechanism. In long-term regulation, basically, we have a RAS mechanism, the renin, angiotensin, aldosterone system. So basically, what is happening in RAS mechanism, if there is decreased blood pressure, you know about the juxtaglomerular cells? Yes, JG cells will release what it will release? Renin. Spelling you know? Yes, renin is incorrect. Renin, renin is in stomach. So there'll be release of renin. This renin, what it will do? It will convert your angiotensinogen, A gen I'm writing, to angiotensin 1, 81 I'm writing. This angiotensin 1 in turn, if it is acted by ACE enzyme, what is ACE? Angiotensin converting enzyme. From where it is released? It is released from your lungs. Remember this. If it is acted by ACE enzyme, which is released by the lungs, the angiotensin 1 gets converted into angiotensin 2. This angiotensin 2, it has two effects on kidney, on blood vessels. Two effects. One effect is on the kidney. I'm running out of time, but I don't want to draw a very gross diagram of kidney as well. So on kidney, if it acts on kidney, it acts on the collecting duct as well as the DCT. It acts basically on the collecting duct as well as the DCT of the kidneys, and it increases the sodium. It increases the sodium retention, or you can say it decreases the sodium excretion. Same, it increases the sodium retention as well as increases the water retention. That is decreasing the urination. Okay, so if it decreasing the urination, then the blood volume is increased. Decrease urination, increased blood volume, increased BP. Understood? Increased BP. So if BP is decreased, it gets increased by this RAS mechanism. I discussed the whole RAS mechanism here. If you have read renal, it's very easy. And if there another effect of angiotensin 2 is on the blood vessels. Here, so we have the blood vessel here. What it will do? It will cause vasoconstriction. It will constrict the blood vessels like this. If it constricts the blood vessels, of course there will be increase in BP. Easy. This is the point. And RAS mechanism is basically important. If you eat, let's say you ate more salt, so the ECF volume will be increased, the BP will increase, and if the BP increases, the renin decreases, because if the BP decreases, the renin increases, and vice versa is true. If the BP increased, the renin will decrease, and renin will decrease. If this renin decreases, let's say we have two situations. In fact, let's say you took more salt. You took. You understood this mechanism. I'm just talking some things just for your understanding, not for some exam point of view. You took more salt, let's say. If you took more salt, your ECM volume increase, of course. Your osmolarity increased, your ECM volume increased, and all. That is, it increased your blood pressure. Let's say, increase your blood pressure. If increased blood pressure, then the renin will decrease. If renin decreases, angiotensinogen will be less converted into angiotensin 1. This will be less, and this all things will be less. That is, the blood pressure will decrease. If all these things are reversed, the blood pressure will decrease BP. And if you took less salt, if there is less salt intake, okay, ECF will decrease, that is BP will decrease. And if the RAS mechanism comes, then BP will be restored, BP will be increased. So if there is decreased BP, will restore the BP. If there is increased BP, will decrease the BP, and by this will maintain an equilibrium of blood pressure by all these mechanisms. And in long run, this RAS mechanism is phenomenal in controlling the blood pressure in the long run. Okay, understood. Another yeah, so we are coming to the end of the lecture, but I need to discuss some other factors for BP regulation. Other factors, let's say, short discussion. Other factors, others, let's write. Yeah, others. So one thing. If you don't know, let me tell you. BP is equal to CO into PR, sorry, cardiac output into peripheral resistance. Okay, and cardiac output in turn, we have formulas. These are all formulas. Cardiac output is HR into SV, that is a heart rate into stroke volume. So blood pressure is cardiac output into peripheral resistance, and this cardiac output in turn is heart rate into stroke volume. If this is the case, any factor that alters your cardiac output, any factor that alters your peripheral resistance, any factor that alters your heart rate or your stroke volume will also affect blood pressure. Will also affect. So any factor, about any factor that will alter these things. Athletes, all you can write. You can write in blood pressure regulation. We have some mediators as well. This is one thing. This is one thing that all factors will like be contributing to the BP regulation. We have some vasoconstrictors. We have some vasoconstrictors. What vasoconstrictors we have? We have like uh, norepinephrine, norepinephrine. We have ADH, or we have angiotensin 2. All this. Okay. Uh, yeah, another one, endothelin. This also very important. Pathology will realize its importance. This all vasoconstrictor. Vasoconstriction means it will increase the blood pressure. These all factors will increase the blood pressure. Likewise, we have vasodilator substances as well. This last point of the day, vasodilators. What are the vasodilators? So in vasodilators, we have adenosine, very important. Adenosine, okay, adenosine, and K plus ions, K plus ions, adenosine, K plus ions, and some inflammatory mediators as well, like bradykinin, histamine. This is all vasodilation. Vasodilation means it will decrease the BP. So that is the end of the lecture on your blood pressure regulation. And what is blood pressure? We discussed all the things. I repeat, I discussed all the important, all the aspects, not important also. I discussed all miscellaneous aspects as well. We read about many things. We read about many. Uh, if you have been following me from the last 70 minutes or so, so I believe you have mastered the topic of blood pressure and the regulation of blood pressure by many mechanisms, so short term, long term, as well as what are the responses. I basically organized the guidance in a short, crisp, as well as palatable format, because the blood pressure regulation guidance is just messy thing around. I covered all the topics. If you feel I have left any specific topic which you need to know, just you can comment on the comment section. You can, as I say, you can reach out to me. Sorry, I'm writing my own Insta ID. Yeah, you can reach out to me at Instagram on this ID, or you can message me your doubts on Gmail as well. Okay, so I hope your blood pressure regulation topic is done and dusted, and I have discussed all the aspects of what we have in our textbooks. That's all, guys, in today's lecture. I hope you enjoyed the lecture. Thank you very much. And if you like the lecture, do subscribe. If you haven't, I should tell you that please do subscribe, because many academic things and this type of topic discussions are there in my channel. And do look out at the marathon sessions of anatomy as well. I have completed the anatomy uh, in marathon sessions. You can just watch it. That's all. Have a very good day and keep reading, keep enjoying. Bye bye.